So I heard about Mr. Abraham through Dr. Eamon Mahfouz. He's a consultant radiologist and he's based in Harley Street. He was excellent. He did the ultrasound and immediately saw that there was a problem with the gallbladder and referred me to Mr. Abraham. I had my gallbladder removed. I had it removed robotically, which was excellent, went very, very well. So how I would describe my experience was it was incredibly positive. So I had for something, which is not necessarily a positive, having an operation, it was a really positive experience. Mr. Abraham was very sensitive, but also incredibly professional about how he would carry out the procedure. He covered everything I needed to know. But he did it in a very understanding way. So understanding the patient, I think he's very perceptive at understanding, the different personalities in front of him. That's how I felt. I felt very reassured that he was going to carry out a fantastic, carry out the procedure in a very professional manner, but also that I was confident that my recuperation would be shorter, which is important for me. So, I mean, the first thing I would say is, if you're experiencing pain, get it checked. The second thing is, when you do decide there is no choice really, in most cases with the gallbladder, but it would be to, be calm as possible and be relaxed, because the team from the start to the finish that I was under with Mr. Abraham and his team, Sharuk, and I'd also like to mention Dr. Saha, who gave me my anesthetic, but the team that's working with and alongside Mr. Abraham are just top class. So I would say, as I did the morning of my operation, I just handed everything. I think Mr. Abraham said to me, he said, "Don't worry," and and I said, "Well, I know I don't have to worry because I'm in your hands." And I'll be asleep anyway, so there's not really much I can do about it. So yeah, it's just, look, these are professionals. Let them do the worrying and return to normal life, because actually with the gallbladder removed, you can return to normal life, and finding I can eat everything, I can do my exercise, so it's life changing, because that or the pain. So yeah, so that would be it. And then I suppose the other thing I would say is, even though I wasn't very good at this myself, but give yourself some time with the recovery. I quite like to get back and going quite as soon as possible, but it's probably a good idea to give yourself a bit of time with the recovery.